this is our second call of our exercise coaching that came out of talking about some research on exercise intensives and then trying to help people set up intensives if they want to do intensives. And then also realizing even people who don't want to do intensives, who maybe are getting started or restarted or have questions or, are trying to address specific things. There's a lot of ways that exercise coaching and discussions can help. And we didn't really have much time for this. There's opportunity for a little bit of questions before and after class, but not really a whole discussion like this. So we are having these calls weekly as of last week, and we'll continue them as long as they are helpful. So first off, does anybody have any questions, thoughts, things that you want to get started with? It's pretty open forum. I do plan still on having a little bit more of a structure to the calls. Like I would love for anyone who has a win that would like to share a win. If anyone has an update on their goal, if you've set a goal and how did that go over the past week? Is that goal being adjusted a little bit? Or if you haven't set a goal, thinking about setting a goal. So yeah, but it's pretty much open. So does anybody have a question to get started or want to share anything?
Question.
Yes.
Shall I?
Yeah,
I have
right
a question. I recently was diagnosed. I think I wrote you this, Claire, in an email. I recently was diagnosed with significant arthritis in both my hips, flagged as severe on the right and moderate on the left. This, of course, explains why my hips hurt so much. Now I know. And I'm just trying to figure out how to deal with that. I don't know very much about arthritis, and I didn't used to know very much about Parkinson's, but because of Rogue, I know a little more. And I just don't know whether any of the exercises I'm doing will cause the arthritis to worsen, whether there are particular things that I should be doing to improve my situation, just how to balance that with the Parkinson's stuff, because I certainly have felt over the last maybe year that I kept thinking, man, I show up, I work out every day. Why is this getting harder? Why am I not, my range of movement doesn't seem what it used to be, and my ability to get up into the higher levels of cardio stuff, it doesn't seem to be happening. And now, of course, I can blame this arthritis piece, but it's trying to make this do enough to address the Parkinson's without putting maybe undue wear and tear on my body, I guess. So that's my question. I would like to know how to integrate the two needs.
Yeah, I think the good news is it's pretty similar. Arthritis tends to benefit from movement and exercise as well. For a lot of people, the arthritis is more painful when they are more sedentary or sitting for longer periods of time, and getting up and moving helps as well. So I would say for the most part, it's overlapping goals of movement and exercise and consistency. I really don't think there's a lot of research that says that you exercising causes wear and tear that is more problematic. I think that arthritis can be genetic. There are other factors that can influence it, but I don't think that you really can like make it worse or harm yourself through exercise. I think listening to your body when it comes to Parkinson's, there obviously is a huge emphasis on high intensity. With arthritis, I think that you listen to your body in a little bit different way, and some high intensity may feel good and be okay for your body. And there might be certain things that are aggravating, and those things you might modify, which I would say is what we try to emphasize no matter what, because pretty much everybody who's here exercising has other things going on with their health too. And although, yes, there's research that says high intensity is good, it's not always the best. It's not always doable every day. Sometimes you have to work up to doing certain types of things. If there are movements that are really aggravating to your body, we're not saying like just push through it. We're saying listen to your body, and what are other options where you can do something similar and keep moving but not feel like you're doing something that makes you feel worse. We're definitely not emphasizing that, so hopefully that comes through in classes. And I do think that I did see your email. Sorry, I haven't gotten a chance to get back to you yet.
Right.
I think having one-on-one visit, and it can be online. I don't think it's necessary for you to come here, but having a visit with either Maddie or Catherine, both of them have more orthopedic experience. So, I feel like I'm expert in Parkinson's, and I can do a pretty good job helping people modify what they're trying to do for Parkinson's based on what else is going on for their body. But I've never really treated people directly where arthritis was, even like the number one concern. And so I think having a visit with them where,
Okay.
they could talk to you a little bit more about things that could be helpful. I think pain is always multifactorial, even when there is a diagnosis specific like arthritis. All the
Mhm.
other things you're doing for your wellness are helpful. You may
Mhm.
want to see about doing something else specifically for anti-inflammatory, whether that is, even beefing up dietary factors a little bit more to
Mhm.
be helpful for anti-inflammation, pharmaceutical medications, or even over-the-counter medications. I don't know, did your doctor recommend doing anything to try to minimize the arthritis or help you feel better so that you can do the exercise you want to do without pain limiting you?
Well, we're just kind of at the beginning of figuring this stuff out. My neurologist, last time I saw him, I was explaining that I found walking more difficult than I thought I should. And he watched me walk and he said, "Yeah, I don't think this is Parkinson's. I think you should go get some x-rays." So that has been done under the supervision of a very nice sports medicine guy. And I'm seeing him on coming Tuesday, not tomorrow, but one more week. And on the email, he simply said, "You should go to physical therapy." And I called all these physical therapy places, and I'm like a total rule follower. I'm not a rebellious person, but they're saying, "Yeah, we think you should come in 3 times a week." And I think maybe like what my husband said is not everybody has an exercise program. So if you didn't and you went 3 times a week and you exercised, that would make sense. But I'm having a hard time, like I don't want to just refuse to do the PT, but I just don't understand what they would tell me if I were to go once a week or 3 times a week. They would say, "You should stretch." And I'd be like, "Okay, like it's all the stuff we're doing."
Mm-hmm. Yeah, I agree. I don't think that you're going to need to go somewhere 3 times a week. And I think that is part of finding the right clinic is people who know what they're doing and also who are going to work with you and what works for you in your schedule and understand that you are exercising outside of this. And what you're looking for is, help to reduce pain so that you can do the exercise you're doing. If there are certain, exercises that would be helpful that are different than what you're already doing, I think there will be a lot of overlap, but there might be some specific things that are different.
Mhm.
And then they may also be using some manual techniques helping, loosen up
Mhm.
muscles and help mobilize your joints in a way that you're not able to do. Um, there is a clinic, I can't think of the name of it right now, that I know the owner, that's right down in Hermosa. Um, and it's sports medicine. They work with athletes,
Mhm.
but the owner also worked at Rancho and she knows more about Parkinson's. And I think there's another therapist there who kind of is a crossover of neuro and ortho. So let me find out what the name is of them and I
That'd be
will send
great.
that to you. So I think that might be a good option. And they're just a unique type of practice too. They're not I think they do take insurance. But in some cases, even, you know, out of pocket, if it means it's a really great practice and you go the
Yeah.
frequency that makes the most sense, like it is better than feeling like you're forced to commit to more times a week than what you really need. So let me find the name of that and I'll respond
Okay.
to you in an email. And then I think having a visit with Maddie or Catherine would also be helpful in just saying, like, if it feels like this, do this instead. Here are some
Okay.
specific exercises or other things you can do. But yeah, I was wondering, like, have you taken ibuprofen or anything over the counter ever to see how that helps, if it helps?
Very rarely I take Advil or Tylenol, and both do help. I think Advil is a little harder on your body, so I've recently gotten more interested in Tylenol, which I didn't think was quite as helpful for me, but maybe is not. So I think Advil does gastric stuff or
Yeah,
something's
and
wrong with Advil.
Advil is more of an anti-inflammatory though, where
Okay.
Tylenol is more of just a, pain reducer. So I
Ah,
think that's probably why the Advil is a little bit more helpful is it may actually be decreasing inflammation. And yeah, they
mhm,
both can have side effects with long-term use. And I also think the amount that is used makes a
mhm,
difference.
mhm,
But I think for one, just trying taking it, even for something like a week and basically the lowest dose that helps, and maybe just once
mhm.
in the morning before you exercise so that you feel better while you exercise. I think that would be worth trying. Um, because then that's just more information that, you know, any physical therapist or doctor that you're working with, you can say this helps to this degree. And I think that then you can talk about, okay, what are the potential downsides, but also the potential upsides. So if it does allow you to exercise better, there's a lot of benefits to exercise and that might outweigh the potential. I really think that a lot of the negatives are with long-term higher dose use. And it might be that you don't take it every day. Maybe you take it on days where you're doing certain forms of exercise, or you're really, you know, 2 or 3 times a week, you're saying, I really want to try to push the intensity level higher. And if I can decrease that inflammation, I'm able to exercise better. You may even find that when you are able to exercise well, it's kind of like with dopamine, where if something facilitates good exercise, sometimes you experience more benefit from that exercise. It's also possible, though, that if you take something that reduces pain and you really push it, it's possible that you feel a bit more sore afterwards. And those are just things like, I hope, you know, hope that doesn't happen. But all of that is information that is really good to know in terms of making recommendations and, you know, shaping what you do. For one, I can say, although, you know, the research says high intensity exercise is, you know, really good. I also have had people that I've worked with over the long term that don't do super high intensity exercise for various reasons, that do more moderate intensity, and they just are really consistent and they are still benefiting from it. So just because there's all this research that says high intensity doesn't mean that that is the best for all people in all circumstances. And it doesn't mean that you can't benefit immensely from moderate intensity exercise either. But I think it's worth trying, you know, Advil like for a few more days to see how much it helps. And then talk to your doctor about, you know, what the potential long-term or negative side effects are. And does it have to do with a certain length of use or frequency of use or dose of use? Like if you could get away with kind of the lowest dose on a daily basis, maybe that is pretty safe. And yeah, there's like kind of stomach, and I can't remember what it is for Tylenol versus Advil. Of what kind of the negative effects can
Is
be
it
over
liver?
time.
Is it liver?
Could be with, is it Tylenol that's
think
liver?
Is it Advil or Tylenol that's liver?
I think Tylenol is liver.
Oh, really?
And Advil is stomach.
But I'm not 100% sure, but I think that's.
Yeah, probably a Google search would give you a little bit of information about that. But then I think talking to a doctor about it is better than the internet. Because then, I mean, my experience is like if someone has other risk factors, like a lot of times people are told one or the other is better for you based on your medical history and your family history. And, you know, if other systems in your body are quite healthy and you're doing all these other things for your health and you're eating really healthy, you may not have to worry about those as much as someone who has additional risk factors or history or something. And the other thing I think is that arthritis, like Parkinson's and anything else, can both exacerbate each other. So when you have Parkinson's, then you have arthritis, like it's, you know, with your hips, I think it's both. It's like your doctor said, it's not just Parkinson's, but I think the arthritis is probably, you know, kind of aggravating the Parkinson's, and then that aggravates the arthritis. So anything you can do though, that does help one or the other feel better, I think can help both of them. And so, yeah, for now, I would say keep moving, keep exercising, but don't worry about high intensity. Do things in the way that feel the best in the moment and afterwards, and keep going with that for now, and do a little bit of a trial or a test with medication that's anti-inflammatory, see how much that helps. And maybe it would be something where you'd say, okay, 1 day a week, I'm going to really try to push the intensity level and get some of that. But the rest of the days, I'm going to stick with more moderate and just be consistent and exercise in a way that helps me feel as good as possible.
One last question. Do you think yoga, which I don't particularly do, is uniquely good for arthritis? Because they seem to, what I'm beginning to read emphasizes stretching and I don't know, maybe I'm just stereotyping, but I think of yoga as having an aspect of stretching almost all the time as you are building muscle, as you are doing different stuff. And thank you, Linda, for your note about Dr. Greger. I will look at that.
Yeah, I think it depends. Yoga is so variable in terms of what yoga is. Like, you know, yoga can be from restorative, very little movement, to pretty high intensity and heat. I think yoga potentially is helpful, but it's kind of a matter of finding the right class at the right level. We do have some yoga classes in our video library that are taught by a physical therapist who works with people with neurologic conditions and orthopedic conditions. So I think
Mhm.
her yoga classes in particular would be good.
Mhm.
Otherwise with yoga, it just really can vary. And why we like power moves to me kind of have some overlap with yoga, but are different because we are
Mhm.
focusing a lot more on extension, and a lot of yoga has a lot
Mhm.
of flexion to it. So flexion of the
Mhm.
hips, flexion, you know, through the trunk with forward bends and stuff like that. And
Mhm.
I don't think that is necessarily bad, but in terms of if you have a certain amount of time to spend exercising, we're trying to do things that counteract the effects of
Right.
Parkinson's. Um, and I think a lot of times with yoga, when it is maybe more for arthritis, in general, it kind of means that it's just gentler. Like there's maybe
Mhm.
not as fast of movements or as long of holds or as many, you know, changes between position. I don't know of any research that says that yoga is particularly beneficial. Um, I think that it compared to power moves, I would say the benefits are pretty similar.
Okay.
But with power moves, I would just say that, you know, picking like if there are exercises that really are aggravating, that modifying, you know, or
Yeah.
using support so that you can get into the position and it feels as good as possible to do that movement. But I can't really think of off the top of my head anything in yoga that would be like that much better than what we're already doing.
Yeah.
But I think if you were interested, like in an in-person class locally, sometimes it just does make a difference to exercise with someone there who can kind of coach you or give you feedback or help you problem solve through things. So that could be
Mhm.
beneficial. For some people, they do like a hot yoga, and that exercising in
Hmm.
warmer can be relaxing and helpful to the muscles. I don't know how much it would affect arthritis directly,
Okay.
but things like that are worth trying.
Well,
Um,
I'm real happy with what I've done, with Rogue, and I don't want to change off of that. I feel very comfortable with this. I feel like it's really helped me do well over these past years. And so it's annoying to have this other thing to think about that potentially asks me to vary what I've been doing because I'm happy with what I've been doing.
Yeah, I really
But
don't
I
think
see
you
your
have to
point.
vary it a lot. I don't think you have
Okay,
to make any
cool.
major changes. I think that doing some physical therapy where they can do some joint mobilizations
Yeah,
and some
I see.
manual work could also get you feeling better and be able to exercise well without experiencing as much pain. And then it'll just be interesting to see. And it's somewhat personal choice about, you know, medications, whether over
Yeah,
the counter or prescribed. I think it depends a little bit on how much they can help and how much the pain bothers you,
yeah,
and feels like it limits you versus, you know, wanting to really take as little as possible, you know, which I'm
yeah,
always all for,
yeah.
but there can be a point. Or I don't know, like, did they bring up surgery at all? Like for the side that has the
Not so
severe
far.
arthritis?
No, not so far. But as I said, I'm going to talk to the sports medicine guy, and if he wants me to talk to somebody different, or he just going to be my person for this, I don't know.
Yeah.
I
And
like him. He's good, and I think he's got a nice balance of doing stuff, but not going nuts either. He's
mhm.
a moderate fellow.
Yeah. And there's other things, there's different types of injections that can be tried. So
Yeah,
there are quite a few things that, you know, can be tried, and each one he can offer that to you and you can decide if that's something you're
right.
interested in trying. And again, surgery is something I'd say we're for the most part trying to avoid as much of the time as possible. It's a big deal to have a surgery.
Sure.
But there are some cases where it is really worth it and you feel
Hmm.
so much better afterwards that you're able to, you know, so that's again, it
Yeah,
depends on how much the pain is limiting you now. And he's, you know, anyone is going to go through conservative treatments first to see how much better it can feel. But in some cases, surgery really is
yeah,
amazing and a miracle. And then you don't have pain in that hip and you can do all the things that you maybe
yeah.
felt limited.
I have wondered. And I
Yeah.
don't want my Parkinson's to progress to such a point where then I have surgery later on and it's harder to rehab, it's harder to recover.
Yeah.
But that I'm getting ahead of myself with all that. This is very new.
Yeah. Yeah. There's no rush on it. I think,
Yeah,
you know, you have years before surgery wouldn't be a good idea for other reasons. And so you can try all these conservative things
right.
first, and hopefully it works and you feel much better with conservative management. And if not, there's always other options. And
Well,
sometimes
thank
they
you.
are super helpful.
That is just what I needed to know. So thank
Yeah.
you so much.
You're welcome. So yeah, I will email you and I'll find out the
Okay.
name of that clinic. And then I will also give you some options if you do want to have a meeting. You know, you can maybe call this clinic and see how soon you might be able to get in. And if they're cool to work with you and your schedule, Alana is the name of the therapist I know who owns it. And like if you told Alana, you know, I've worked with Claire and she told me about your clinic, She'll remember me. And then I also will give you a couple options though if you wanted to have a meeting with Maddie or Catherine
Okay.
to kind of just talk about like how does physical therapy for arthritis look different versus
Mhm.
what is the overlap. Because that could help you at least get started too, depending on how quickly
Sure.
you're able to get in.
Thank you. That's fabulous. Thank you
You're
for all that.
welcome. But yeah, for the most part, I don't think there's going to be anything that's super dramatically different than what you're
Great.
doing right now. All
Perfectly
right.
happy. Okay, thank you.
Mm-hmm. All right. Who else has that question or update? Gay, do
Well,
you have
I
an
can,
update?
I do. I did just what you suggested. 5 minutes of bike, 5 minutes of the treadmill, and 30 minutes of power moves. And that was pretty good. I did an hour of line dance one day and 45 minutes in the garden. I should have stuck to 5 minutes in the garden. I was miserable afterwards. I should have listened to you. But I don't have significantly more pain. So I decide my goal is this week I'm going to just continue on that schedule. Maybe I'll add my own line dancing like 5 minutes a day because that's not too hard on my body. And next, I'm a photographer, and next week I'm mentoring some. I'm retired, but I'm mentoring some younger gals, and I need to have a lot of energy to photograph preschoolers. So I don't want to take the chance of being in a lot of pain then. And then
Mhm.
I also checked uh, the book that you recommended that I've read quite a few times, and I found out I'm really special. I'm like in 1%. Uh, my, just last week, because I keep notes of my dyskinesia or whatever is happening with my feet. Every day, every dose, all day long, I write it down. And then I got a new symptom where into my dose, like about 15 minutes into it, then my feet are starting to get goofy again. And I'm thinking, oh my gosh, now there's something else. But today I was reading, and it's called biphasic dyskinesia, where you get a little bit of the symptom in the beginning and then a whole bunch at the end. I'm like, that's exactly what's happening to me. So
Okay.
I'm not sure what I'm going to do about it, but well, I kind of figured out my preference is to have 2 doses of medication a day. I tried overlapping them. Oh my gosh, I had side effects all day long. That was just driving me nuts. So I just have to realize what I like in dosing. Now my dose is running out, so I can't speak. But it was a good week.
Okay, good. Yeah, I'm very excited by that. And I think, yeah, gardening is a lot. It's a lot of up and down and being in like a crouched position. So yeah, trying
Mhm.
to, if you know, like I want to do all this, if you could do the gardening for break it into smaller little chunks. And if
Yeah.
you don't do it this week because you want to feel as good as possible for the photography, that totally makes sense too. And the line dancing class that you did for an hour, you didn't feel too sore after that?
Well, I was in pain while I was doing it, which is unusual. That's just started the last few times I've went. But it wasn't too bad the next day. And I love doing it, so I don't really want to give that up.
Yeah, and I don't feel like you should have to give it up. Maybe you take rest breaks a little bit during, possibly. The other thing for the medication right now that you're taking, are you taking regular carbidopa levodopa 25 over 100?
I am, and that has worked the best. And Lori Michelin recommended the new time released one, but boy, I got side effects right away on the second dose.
Of
And
Crexont? You
yeah,
tried the Crexont?
yeah. And so, and considering I probably have to pay for that out of pocket, um, it just wasn't worth it for me. And I found out I like being a little bit independent with my medication and taking it when I need it, as opposed
Mm-hmm.
to all day long.
Yeah, and carbidopa levodopa gives you the most kind of flexibility in how
Yeah.
much you take and what times of the day that you take it. Okay. And did you ever try just controlled release carbidopa levodopa?
No, just the regular.
Because it might be something to ask about next time you see your neurologist. There's a controlled release of carbidopa levodopa. It doesn't tend to work as well for most people, and can be a little bit more variable in its absorption, which is why it's not used as often as the immediate release carbidopa levodopa. But it basically has a slower onset into your system and a little bit slower out of your system. So for people who have side effects as it's coming in and as it's going out, it's possible that it could smooth that out a little bit. And you can take controlled release carbidopa levodopa along with, or kind of working around with the immediate release. So it's just one that might it might be helpful. The Crexont is, it has short acting and long acting in the same pill. And the short acting is stronger than, like, first there was regular carbidopa levodopa immediate release. Then they developed controlled release and they realized, okay, it's not as consistent in its absorption because it's getting absorbed slower. So it goes through your digestive system and it's a little bit more variable of when it gets absorbed and how well it gets absorbed. So it's not used very often, but we do have some people who are on both. They're on immediate release and controlled release, and they kind of like adjust a little bit between those two. Then Rytary came out. Rytary is immediate release and long acting, but the immediate release was pretty mild. So for a lot of people, they didn't feel like it worked as well as immediate release carbidopa levodopa. But for people who experience dyskinesia and side effects, sometimes Rytary is better. Then the newest one is Crexont. Crexont has more immediate release, and then it also has the longer acting. So for people who felt like Rytary did not work well enough, for some people, Crexont works better. But for someone who's sensitive like you, I don't think Crexont would be better than Rytary. I think Crexont would give you more side effects because it's stronger immediate release. So I think that regular carbidopa levodopa controlled release, I think would be an interesting option. And I actually think Rytary might be an interesting option for you that would be less likely to cause side effects as it's first getting absorbed into your system.
I will talk to my doctor about that. Thank you.
It's nice, like, if you can be given
I
a
concur.
prescription or samples for a period of time to be able to try it out. Sorry, Carrie, go ahead.
I would say I concur. I've been on immediate release forever. I tried Rytary, but again, it wasn't enough at the beginning, and I'm on Crexont now, and my dyskinesia is far worse.
Worse even than it was.
I would say, Gay, I would.
Sorry, I think we have a little delay.
I think I can.
Yeah.
Carrie, the dyskinesia is worse on Crexont.
Not sure what you asked, but
we're both waiting.
Yes.
And then when we talk at the same time. I don't know what the exact delay is. So the Crexont is more dyskinesia than Rytary, or more dyskinesia than the immediate release carbidopa levodopa?
Then immediate release.
Interesting. Yeah. And I mean, I can see how that would happen. Basically, the immediate release part is stronger, but then it also has a longer acting. So it's kind of like if it kicks you into dyskinesia, I can see how it could keep the dyskinesia going longer, where immediate release, even if it kicks you into dyskinesia, gets metabolized out of your system a little bit faster. So it wouldn't necessarily last as long. I can see how that would be true.
Right.
So yeah, so Gay, I think like Crexont isn't the right fit for you, but there still are a couple other things that I think you could, experiment with a little bit that could be helpful. And in terms of the treadmill and bike time, if it feels like another week of 5 and 5 is right, I totally support that. Otherwise, if you felt like I'm ready for 6 and 5 or 6 and 6, like I think the goal is to start to increase, but very incrementally. We're not going to jump to 10 minutes. Like the next increase would be to do 6 minutes, and it might be 6 of one, 5 of the other, or 6 and 6. But that it's going to be really
already I think I'm already at 6 minutes because I count that as my slow down time. So that's good to know.
Okay. Yeah. So then the next bump up would be to 7. So you're literally going to go up 1 minute at a time. And whether that happens weekly or you give it a couple weeks in between when you bump it up. It's totally up to you. You can feel things out, and it might be depending on the week that you have. If it's a busy week and you don't want to push things more, then keep it the same as what you've done. But if it's a week where you're like, okay, I don't have a lot of other stuff going on, I'm going to start to increase that by 1 minute at a time.
Sounds good. I'm taking notes here.
And then the other thing I wanted to share with you too, I saved a post from Dr. Michael Oken that, pull it up again and see if I can pull up the actual article. Parkinson's. Okay. So here is this article. I'm going to share my screen and I will share the link for this article as well in the chat. So speaking of pain and how we talked about, like, kind of sometimes doctors say pain isn't a part of Parkinson's. Well, that's not really accurate. Here is the link for this article. And they have the full text available for free, which is always exciting. You know, reading this yourself might be interesting or it might be overwhelming, but you also could just print this article and take it to any doctor that you're seeing. So I am going to share, I don't know if I can pull up Dr. Oken's post, because I haven't read the article yet. So Instagram.
And where would we find that link?
So I just put the link in our meeting chat right here.
Okay.
So in the chat, basically, you could click on that link. It's going to open a web browser, and it might kind of feel like it takes you out of the Zoom meeting, and then you have to click on Zoom to kind of come back into the meeting. I will share the link in the daily email tomorrow, because I'm sure there will be other people interested in it. And then look, Michael Oken right here. That's who I want to follow. So the pain, and he posted a lot. Here we go. So I want to look at his post though, because he summarizes things. I'm not going to look at the whole article right now because that's overwhelming for me. I haven't read it yet, so I can't summarize it. So he showed this picture though, which shows, you know, a man, the shape of a man and the shape of a woman. So looking at chronic pain and Parkinson's, prevalence, how often it happens, the differences between genders, regional anatomy, and comorbidities. And so then to summarize, he says, chronic pain is one of the most under-recognized burdens for folks with Parkinson's disease. It is time we bring chronic pain in Parkinson's out of the shadows and address it as a central part of the care plan. Oganowski and colleagues tackled this topic head on in a new article of Annals of Clinical and Translational Neurology. Key points. 2/3 of people living with Parkinson's experience chronic pain. So the majority of people who have Parkinson's experience chronic pain. And basically chronic pain means pain that lasts, you know, longer than, you know, a few weeks at a time. Women report more frequent and more severe pain than males. Pain is strongly linked with depression, sleep disorders, and osteoarthritis. So that means linked means like, you know, we don't know what's causing the other one. If you have pain, that can certainly make you feel depressed. Pain is a very challenging thing to experience. It can affect sleep. Arthritis, it sounds like they're saying like that's its own diagnosis, but that there may be, I mean, here pain is strongly linked with osteoarthritis. That makes sense because that's the typical symptom of osteoarthritis. But I still think when he's saying linked here, it's basically like, you know, the chicken or the egg. I think people who experience more depression also experience more pain too, sometimes without a clear physiologic reason for that. And when for sleep, like if we're in pain, it's hard to sleep. If we don't sleep well, we are more likely to experience greater pain. So the good news is there's often multiple ways to kind of come at this. So if you really focus on your sleep routine, and in some cases that might mean adjusting medication to support sleep, whether that's dopamine medication or there's other medications, but things that help you sleep better could really help you experience less pain. So his take, most neurologists and healthcare providers skirt around chronic pain in Parkinson's and fail to address it. This needs to change. Here are 5 points that resonated with me about this article. Chronic pain is common in Parkinson's, however, it is frequently underdiagnosed. Pain may appear in many body regions, including the back, neck, buttocks, and knees. Pain can be related to motor symptoms. However, it can also be related to mood, sleep, and other conditions. So basically saying, you know, you don't necessarily have to have worse motor symptoms to experience more pain. You know, you could have mild symptoms of Parkinson's and still experience significant pain, and vice versa. Environmental exposures like pesticides may possibly increase pain risk, and managing pain requires a team approach, including medical care, mental health, and addressing lifestyle factors. So basically just to know that what you're experiencing honestly is pretty common. It is not unusual. In the actual article here. So if we click okay, PDF, this is what I will share tomorrow, because the PDF is usually the easiest to kind of look at and download. So this is an article that if you are interested, you can read yourself. If it's more you want to download it and give it to your doctor, they're going to, you know, the abstract is always helpful. And they're saying they looked at 10,000 people in Australia. I feel like Australia is pretty similar to the US. And so they looked at prevalence, age and sex differences, severity, anatomical distribution, clinical history, and associated factors. Female. So 2/3 overall reported chronic pain. Females, higher prevalence, 70%. That's the vast majority of people are experiencing pain, and it's not really getting addressed. So sometimes, I mean, even though that hasn't necessarily done anything to minimize your pain, just to know that like what you're experiencing is not uncommon, and it not really being addressed by your doctors is not an uncommon experience either. So I'm just trying to see if there's anything else. Basically, they did a questionnaire. They did the study analysis, multivariable associations like that. I think would be that would be an interesting section to read. Those are all the results. How all these other variables affect it. History. Body parts. There's your hips, Barbara. So yeah. And then the discussion. The discussion is usually written to be understandable to a regular person. So if the rest of it you're reading it and you're like, oh, I don't really know what they're talking about, reading just the discussion could be helpful. And otherwise, I think this is an article to either print and give to your doctor or to forward to them and say, like, you know, other things are kind of manageable. The pain is really what is one of the biggest challenges for me. And I want us to investigate this a little bit more and see what we can do, both with the neurologist and also, you know, them making referrals to other healthcare professionals that may be able to help a little bit more, because pain is something that they're working with people on a more regular basis. So yeah, just wanted to share that validation of what you are experiencing. So I will share the link for this, the actual PDF, because that's the easiest way to get to it. I will share that in the daily email tomorrow. And then I'm putting it in the chat here too, for anybody who'd like to download it now.
Claire,
Thank you.
one of my goals is to increase my steps. And 7,000 is a lot of steps for me. I don't know, is that norm?
I would say, I mean, 7,000 is a lot. It's very easy to not get 7,000 steps, but I think if you decide this is a goal and you work towards it, I think it is also totally achievable. For most people, it takes about 10 minutes to get 1,000 steps. So it's thinking that throughout the whole day of your waking hours, you probably need to be up and moving for like 70 minutes total. And you're going to get credit. Like if you're in a class, you're going to get quite a bit during that time. But then just thinking, and for one, are you measuring your steps where you're at right now?
Yes.
So how many would you?
I use my Apple Watch.
Okay, that's
my
great.
Apple Watch is on, and wherever I go, I'm counting.
And so how many steps a day are you averaging right now?
I get about not quite 4,000.
I think that's pretty good start. So I would say like your goal, if that's already the norm, is to say, okay, I'm going to try to add in an additional 10-minute walk each day. And my goal is going to be to get to 5,000 steps per day. And that would be the first step, because any amount that you do over what you're doing right now is beneficial. And again, I'd say in most cases, you want to kind of work your way up slowly so that you don't overdo it and then don't feel good, because that's going to make you less motivated to keep working towards that goal.
Right.
So we want to make kind of those smaller changes at a time. So I think 4,000 is great. You're more than 50% of the way there already. And if you could say, I'm going to do a 10-minute walk, and get to 5,000 a day, that would be a great start. And so that walk, it can be, you can look at each day, but like walks after meals are really good for us because they help our body kind of, manage the glycemic load a little bit better. It can decrease your blood sugar and be healthy overall. So if you say like after one of my meals, I'm going to go out for a 10-minute walk in my neighborhood, I'm going to walk 5 minutes away from my house, turn around and come back. If you want to come into Rogue more often, or you want to come in and walk on the treadmill for 10 minutes before your power moves class, so that's what I think the first goal is to do 10 minutes each day and try to get to 5,000 and then see how that goes. And then you can decide, is that 10-minute walk and going to turn into a 20-minute walk, or does walking for 10 minutes after a meal feel really good? And you're going to do that a couple times of the day. So there's a lot of, ways that you can insert those steps throughout the day. And I think that you will be able to get to I think you'll totally be able to get to 7,000.
Okay, yeah, sounds good.
And that's a
Will
great
do.
goal. It definitely helps to have some specific things for many of us.
And then another thing, which is part of my plan, I've always been dealing with my back problem, and it's gotten better. I've learned to manage it, but I thought that I would because the doctor recommends PT, that maybe since I have PT available to me, I would take PT. And I did sign up, and it was Dr. Bixby. So I did it through Hogue, and I got Mike.
Great.
And so I'm going to see what he says. I see him on Friday.
Yeah, excellent.
Because
Absolutely.
that affects my exercise, my back.
Yeah. Yeah. I really think that most people should be accessing, in addition to just a regular exercise plan, accessing the individual therapies whenever it supports you. And, the way that Medicare and most insurance companies work is that there's kind of a reset each calendar year. And
Right.
so, yeah, I think use it. Like, you've paid into this system.
Yeah.
Working with a good PT one-on-one can help you either do the exercise you're doing better, or they can do, some manual and other techniques that you would not be able to do for yourself that help you feel better, getting some mobilizations to your spine to help get things moving. Like, it is hard for us to move and mobilize our own spine, especially when it's stiff. So lying on a mat and having someone work on it can really help it feel better. And then the goal is, because when people do that kind of manual work, if you don't do anything differently, it doesn't tend to be long lasting. So it's saying, okay, I'm going to take that better posture or flexibility or less pain that I have, and I'm going to increase my exercise a bit. I'm going to do a little bit more. I'm going to go for a walk because now I can, because I'm not experiencing as much back pain during that walk. Or I can, do a little bit more strength training because I don't have pain.
Yeah.
And the stronger you are, the less back pain you're going to have. And then if something like walking, if one of the reasons that you're not walking is because your back starts to hurt during that walk, in that case, what I would highly recommend is using hiking poles. So hiking poles give you a little bit of support for balance, but they really take pressure off of your joints when you're walking. So for anyone who has joint pain when they're walking, research has shown that when you use hiking poles, or they're basically called trekking pole. Trekking is hiking or walking with poles. So you could see them as hiking poles or trekking, but using them decreases the pressure on your joints. So whether it's your hips that are uncomfortable, whether it's back, ankles, knees, really almost any joint in the body, when you use those poles, you take a little bit of pressure off the other joints in the system. You're able to stand up a little bit taller and do more, feeling better. And then that's going to help you. So that might be something to think about on your walk, is possibly using those hiking poles.
Good. That's good. Good suggestion.
Mm-hmm.
And I really the PT, hopefully, just make sure that my gait's right, my walk, improve my balance, and I have a
Mhm.
little arthritis.
Mm-hmm. Yeah. So yeah, there's lots of things. And I think, be proactive about PT use and think like, okay, each year I'm going to do 1 or even 2 bouts. Like, if you don't need a lot of visits, the amount that Medicare will pay for, you often can kind of do 2 bouts in a year. So maybe you do one a little bit earlier in the year to get you started, get everything feeling as good as possible. You don't need to necessarily use up all the Medicare dollars or go, for too long. It might be like, well, 6 visits is really helpful, or 10 visits is really helpful. And then I'm going to keep up with my exercise. And if and when something comes up later in the year, I'm going to access therapy again. But having a consistent exercise routine and then using physical therapy as needed to help keep you feeling as good as possible is definitely the way to go. And whether it's doing like 1 bout of physical therapy a year or 2, I highly recommend it.
Thank you.
Mm-hmm. All right. Anyone else have any questions?
Would you talk a little, this is Jan.
Mhm.
Would you talk a little bit more about getting started with biking?
Mhm.
I have a stationary bike, but I'm not using it consistently. And I was trying to start with 20 minutes, which is probably too much in retrospect.
Mhm.
Maybe just cutting back is, I was curious about your comments about going very slowly with the increase.
Mhm. Yeah. So when you did 20 minutes, what would happen when you did 20 minutes?
My legs would get tired.
Okay. And tired, like while you were exercising, did it feel like it affected you afterwards as well?
No, it was more while I was exercising. I ran out of motivation.
Okay. Yeah. So, I mean, it doesn't sound like 20 minutes is way off what you are capable of, but certainly, like, did it feel like you did 20 minutes and then because you got tired, you just didn't feel motivated to do it again in the next few days? And so it's just happening pretty
Right.
sporadically?
Yeah.
So in that case, I mean, getting a bit tired during exercise is not a bad thing, especially if it doesn't affect you afterwards. I don't think you way overdid it, but some of it is like psychological, and we have to figure out like what is an amount of exercise that I enjoy doing and maybe even look forward to would be, hopefully you get to that point. So I would say something like cutting back to 10 minutes and saying, and like having a goal that I'm going to do 10 minutes almost every day. Cause yeah, I would say less time, but more consistency is going to feel better. And then basically slowly working your way up. So I would say, if the first 10 minutes of the 20 minutes, did you feel pretty good during that time?
Yeah.
Okay. So yeah, that's what I would do. 10 minutes, you feel good, and try to do that on a daily basis. And then you can go up, whether it's increasing by 1 minute or 2 minutes or 5 minutes, like, there isn't one right answer of exactly how much. I'd say part of that is just, what is most appealing to you. Because if you're doing it in a way that feels good or appealing, you're more likely to do it. And then you're more likely to benefit from it. And so, yeah, at first you're just going to pedal at whatever speed feels comfortable with whatever amount of resistance feels comfortable. And the goal is to work your way up towards 20 minutes. When you get to 20 minutes, say how you feel. The majority of research studies do like 30 to 45 minutes of aerobic exercise. So that can be in your mind as a long-term goal, unless it makes you not want to do it, and then set a shorter goal. Because anything is better than nothing, and working your way up over time is going to be good. But I'd say there may be a point where, you're going to start with shorter amounts of time on a daily basis. I would say once you get to 20 or 25 minutes, then either you might still do it every day, but you might start to alternate and have one day be a little bit higher intensity where you do try to push the speed or add more resistance. And then the other day is like, you think of it as your just like loosen up day. So you just get on the bike and pedal whatever way feels good. Because still doing something on a daily basis can be helpful, but you're not going to necessarily want to do like high intensity every day. But we can get there. We can talk about that more once you get there. But yeah, I would do 10 minutes, try to do it on a daily basis and whatever way feels good, and give that a week. And then we can check in next week and see how it went and what seems like the right next step to take.
Okay. Thank you.
You're welcome. Because yeah, the other thing that's super important is autonomy, which is like you making decisions. When you get to decide like what you're doing next, you're likely going to be more likely to follow through and do it and enjoy it more than if it's me telling you, oh, you have to do this next. So that's my goal, is to try to give options. If I am saying do less, like, I might be a little bit more firm in that. But then as you're progressing, you have options of how you do that. All right. Great question.
This session on Monday keeps us motivated, or keeps me motivated. You have your, oh my gosh, I don't really want to do my exercises today, but it helps. It really does.
Yeah, I
Yeah.
agree. It's really helpful to have a check-in and a little bit of accountability and, you know, an opportunity to share what your goals are and what that progress is with other people who understand what you're going through and are also making those goals and working on it themselves too. And that's, I think, yeah, like everyone here is capable of doing this level of exercise, but it's much more the psychological and mental and motivational side of things that can be a challenge for a lot of people.
Claire, was one of our, it seemed to me we had an assignment. It was either share a win or make a plan or something. So I've been a little bit frustrated just because I'm not able to, well, after I come back from vacation, I want to start. And to me, it'll be easier to know what I should do for high intensity and power moves because you have those classes every day. But the thing that's bothering me is that last hour, the OT, hour, because I'm a person who needs a plan. Like I just can't do things kind of off the top of my head, but maybe it's because of my career. You don't want an editor just, not sticking to the rules. So I have made a chart of what I want to work on for OT. And I don't want any of you to feel sad that you don't have the technology that I have.
Oh my gosh.
I'm gonna add your spotlight on.
So
And color, no less.
yes, some of it is crayon even. But what I decided was what were the things that bothered me the most that I wanted to work on? And writing probably even makes me sad. This is like 60 minutes, 10 minutes
Mhm.
each thing.
Mm-hmm.
Writing makes me so sad. It could be 50 minutes. But guys, I can't write for 50 minutes. So I want to figure out exercises and what I can fit in that would be OT stuff that would help my writing. And then the other thing that makes me kind of sad or slightly worried are my fine motor. And I think one time, was it Linda Mayer who's mentioned a YouTube she had found, and I think you have some, Claire. So I've got to figure out how I'll do these two most important things. And then what's
Mhm.
yellow? Grip strength. I noticed my grip strength is kind of fading. So that
Mhm.
kind of makes me worried. And then facial expressions and speech. Sometimes we were doing like face yoga with Stephanie and speech.
Mhm.
So that's what I have to fill in now. I've got to I figured out what's most important to me or what would really motivate me to have that last hour of OT. And now I've got to figure out what it is that goes in those pies.
So you do
Awesome.
like power moves for an hour and a day, and then you'll do your OT?
So I think if we're following this one thing, there's going to be 3 hours for the intensive. So one is a little more high intensity, one is less intensity, and one is OT.
Okay.
I have that right?
Yeah, so that's like the Italy group that has done that exercise intensive that's been shown to be really beneficial. It was 3 hours a day, 5 days a week for a month. And so that's one option. Like people can approach their exercise in all different ways. For some people, like you having the do PT right now, Sally, and then have a step goal, that's a great goal. So Linda, it sounds like you're planning on when you come back from your trip, you're planning on basically trying to do this intensive and see how it goes.
Yeah.
And so the physical exercise, power moves and high intensity is a little bit easier because we have those specific classes on a daily basis, but the OT was the harder one. Now you've identified what things you want to work on. But the exact exercises, when do you get back from your trip?
October 6th.
Okay. So Leanne is going to join us in this Monday meeting on the last week of September. So you'll still be on your trip, Linda, but we will record that meeting. So for anyone else though who wants to kind of put a save the date, Leanne is an occupational therapist who is awesome and is, a big exerciser and super fit herself. Specializes, she can help with fine motor dexterity, handwriting. She works with people on vision sometimes, cognition. There's a lot of things that fall under the umbrella of occupational therapy. So she is going to join us on Monday, September 29th, I think, right? That's the Monday. Yeah, the 29th. She's going to join us to talk about like when she's seeing someone, what would she normally be evaluating? What would she be asking them about? How do you figure out what we want to work on? What are our goals? And then she'll talk about, here's some of the most common things that we do. So that video, when you get back, Linda, you can watch that video. And then also in the video library, like I would say, Linda, it's probably going to be best to, like, even though you want to spend a certain, I mean, it's up to you. So one option would be to say, okay, I want to start working on all of these things immediately. And then, so you got to figure out what are those exercises going to be. Or you could say, okay, the first week I'm going to get started with fine motor exercises and just get familiar with that. And then week 2 of the intensive, I'm going to add in the handwriting. And then week 3, I'm going to add in grip strength. And then week 4, I'm going to add in, and like the facial expression stuff you're doing anyways. So it's up to you if you kind of want to start with something and then add on, or if you want to get some variety. So that's something you can think about between now and when you get back from your trip. But did you see in the video library where we have the fine motor activity? So that would definitely get you started. I'm going to share my screen really quick and then I'll pass it. Wait, today's Monday, so speech is not coming on right now. I thought I was running into speech class. That is not today. So if we go to browse and then we go down to fine motor. So we have fine motor with Sarah, handwriting, and then we have a handwriting update with Leanne. So those 2 are the ones that I would watch specific for handwriting and to get some ideas of specific exercises to do. The intro to Leanne and fine motor, that one I would do for more generalized fine motor activities. And then we have just some fine motor with some simple home things. This video of Emily is fine motor without needing any equipment. And then this fine motor is with having some small equipment at home. So like these 2 would be your handwriting section. These few would be your fine motor section. Strengthening with Sarah for grip strength. So yeah, I think if you have not gotten a chance to check out these videos yet, I think this would be a really good start for you. And between Leanne's video and then watching some of these, then once you get started with the intensive, you can let us know how it's going. Do you feel like you have the right amount of exercise to do for each of those sections? How's it going? Do you need more ideas or more support? Or is it kind of just a matter now of following through and doing it? But I think that'll be exciting. All right. Anyone else have anything for today? All right. Well, Linda, have an amazing trip. Can't wait to hear all about it. And you can always pop into Zoom from wherever you are in Europe if you want to say hi. And then otherwise, we'll check back in next week again. Same time, same place.
Thank you. Thank you.
Great.
so
Thanks
much.
a lot.
Yeah,
You're
thanks.
welcome.
Safe travel,
Thank you all
Linda.
for joining. All right. See you later.
Bye-bye.
Bye.
Love this group. It's
Me
fun.
too. Me too. Same. Bye.